Welcome to Oncology Revolution, where science meets care to transform the cancer journey. We explore evidence-based strategies to enhance quality of life, promote longevity, and empower patients and professionals to thrive beyond cancer.
Hello, Mattia.
Hello, I'm fine, and you?
I'm doing very well, thank you. Well, above all, thank you very much for accepting to be part of these live. We're super excited. It's a very important theme for people that are dealing with oncology issues. So, first of all, I'd like for you to have a chance to introduce yourself, explain exactly how you ended up working with oncology patients.
Okay, yes. Thank you very much, first of all, for the invitation. It's really a pleasure. When I found the Lifestyle Oncology initiative online, I was immediately really happy to see and really willing to join. So thank you again. And as part of my, let's say, background and the reason why I got into this field, well, I started as a, let's call it a normal sports scientist. I'm from Italy, from Bologna. And then I also did my master's degree in health and physical activity, like research oriented. And it's quite a story. I already told this to one of your colleagues when we introduced ourselves. It's a bit romantic, let's say, but it's nice. Let's say that we had it was 2017, no, 16. There was not much, at least in Europe, on the field of exercise as oncology, but there was this professor in our master from Cologne that he did a 2 hour lecture on the benefit on exercise and cancer patient, and I was still in a phase, to look what I want to become, because the sports science field is so big. You have sports rehabilitation, chronic disease, and we had this 2 hour lecture on exercise and cancer, and then I said, yeah, that's my topic. I really found my topic, and after that I went to the Netherlands in exchange in Erasmus to be a, let's call it exchange research assistant in a couple of trials on exercise and cancer patients in Utrecht and Groningen in the Netherlands. And then when I finished, I came back to Italy and I saw that there was nothing going on that topic. Really, it was barely the minimum advice that you give to patients. Usually make some movement, do some movement, And then with a couple of colleagues of mine, we founded a little no-profit association, mainly for divulgative purposes. We started writing articles, making live on Instagram, live training for bigger NGOs, and since then it has all been going on, and now I work in a center that deals only with cancer patients in terms of rehabilitation, and here I am. So it's really a nice story. I think I'm really I think I was lucky and persistent, both. And really, it's really satisfying, a really satisfying job. And also the momentum around the exercise oncology, I can see that is really growing at the moment. So.
Well, yes, and you are very right. It's not only growing, but we are also noticing more and more patients with oncology disease, which, it's something that's unfortunately we are getting more and more cases every year, especially to younger people. And that's something that is also very interesting because of the fact that younger people usually are more active and they might believe that during treatment they shouldn't be doing exercise. And I mean, there's already enough studies that show that's just the opposite, correct?
Absolutely, yeah. Especially now, there is the big challenge study on colorectal cancer patient, which is really spreading the news and the evidence that exercise is beneficial, of course, for quality of life, counteracting fatigue, treatment side effect, pain, all these, let's say, perceived outcomes, but also now, especially this challenge study showing that it has a great risk reduction on mortality and recurrence. So like clinical outcomes. So I hope this will convince more and more oncologists and doctors to prescribe actually exercise intervention to patients.
And you just brought up an important point, oncology doctors. So
Yeah.
how do you go about trying to, in a way, educate oncology doctors that physical exercise is part of the treatment in a way, correct? I mean, because I'm sure that that's something that's still a work in progress, correct?
Absolutely, yes. This is something that I discuss every day, even with my patient and with the doctor, with colleagues. The positive effect is that it's growing. It's growing, especially the younger oncologists or the more, let's say, holistic oncologists, we can also call it, that have a patient-oriented view, which it's not always the case, unfortunately, because of lack of time, resources. We come from a similar country, so we face similar issues in the healthcare system, but I guess it's almost the same everywhere. But yeah, like I think like these initiatives like yours, like dissemination activities on the importance of exercise, is convincing more and more young doctors or oncologists in general to really go behind the basic suggestion, to do some movement, which we know that in a few people, in a few patients, it works because probably they were already exercising before and they are, used to exercising. So probably like during treatment, they downgraded a little bit in terms of exercise, but they still keep on doing it. But also like the switch should come from that like suggestion to an actual prescription, because also in my field, and I've seen some colleague of mine also invited in this podcast, there is a growing body of exercise professional and physiotherapists as well that really are specializing in exercise for oncologic patients. And also what I am seeing every day in the gym is that patients start asking for it to their oncologist. And I think this is also, let's say, coming from the bottom change that can be helpful, because if patients ask for it, they will find a way to do it. So I'm still hopeful, for the future, even though for what we were saying before, the lack of time, the lack of resources, a lot of patience for a few doctors, and other maybe cultural reason, there's still, a long way to go.
Yes. And then, as you said, so, your work right now, apart from, of course, working directly with oncology patients, is both education to the patients themselves as well as the oncologists, which is not, it's a tough place to be at. So when you are dealing with a new patient, for example, that comes to you, what are the first steps that you take to start working with them?
Yeah, thank you for the question. It's really like the initial contact with the patient is super important, and I think it is like it translates from exercise to nutrition to body mind techniques to any approach that goes beyond the medical approach. And so in the exercise oncology, we have this term, this phrase that goes, one size does not fit all. That means that for every patient, depending, of course, on the disease, on the type of cancer, on the treatment, on the side effect, you really have to personalize what you're doing. For example, I see very different approach when it comes, for example, if a breast cancer patient has had a mastectomy or a lumpectomy or with axillary dissection or not. This also includes other healthcare professionals in the care continuum, like physiotherapists, for example. And but like so, first thing to do is to really know and assess which treatment they have done, which treatment they will do, uh, all the personal history of comorbidities, of other conditions, because it's quite spread nowadays. For example, shoulder pain, low back pain. So you have to kind of understand whether it comes from the cancer treatment or if it's something that was there before, or if it has worsened with the cancer treatment. And after that, it comes the real part, meaning that you really gotta approach the person in a understanding way, understanding their beliefs, their willingness to do physical activity, their circumstances. Where I work, we have either a live program where they come 2 times per week, or let's say a remote program where they come every 6 weeks to renew an exercise program, and then they can exercise alone. But in order to do that, you really have to check whether they are going to exercise alone, whether they have the equipment for it, whether they have the motivation for it, the family circumstances. I see many times a mom with 3 or 2 kids. For her, exercising at home will be a challenge, that's for sure. So depending on the context, both like personal, but also clinical context, I think there should be an advice whether to exercise in person with a trainer. We do small groups, which are, I have to say, super fun because they get to know each other, they interact and stuff like that. So this is also something that for somebody that is a bit in a low mood, a bit in a depressive and anxious state, that can be also the power of exercise also translate to that, I think. So really, otherwise there are some people that are really autonomous, or maybe they live far, they have already a tight schedule, so you don't want to overburden them. So also this consideration in the exercise prescription, I think it's very important, because you can make the most perfect exercise program prescription with the right type of exercises, but if they're not going to do it, it won't work. Yeah.
Yes, I understand. We have here quickly a question that Dr. Laura was asking, who is talking? So can you, perhaps some people arrived a little bit later, so can you just do a quick summary of who you are as a person, as a professional in the oncology world?
Absolutely. I'm Mattia. I'm from Italy, specifically from Bologna, and I'm an exercise and cancer rehabilitation specialist. I got a master degree in health and physical activity, and then I specialized with the Can Rehab Institute from Anna Campbell on exercise prescription for cancer patients. And nowadays, I'm working both privately with patients in my own studios, or also in this Prime Center, which is close to Rimini, in the north of Italy, next to the sea, in Cesena. And this is the biggest center of integrative oncology in Italy. And I also collaborate with a few associations in the Italian setting.
Perfect, thank you. So another question that many times, myself, I'm a cancer patient. So, I do recall everything I went through 11 years ago. One of the big questions I recall at the time was many people wonder when to start physical activity. For, let's say, if it's someone that actually never did it, for example, and many people think that sometimes they should wait until post-treatment, post-chemo and radiation, which is not true, correct?
Yes, correct. This is also something, going back to what we were saying before, that also most oncologists think that they should start exercising after chemotherapy. And yeah, as you said, no, it's not like that. They, on a clinically base, they should start, well, in an ideal world, just after diagnosis, let's say. But of course, it's easy to say that, but then it's not easy to do it when you are in chemotherapy, depending on the treatment scheme, depending on the intensity of side effect. So we see patients in our center in both circumstances, whether they have finished, for example, we have the majority are breast cancer patients, so I'm gonna like refer to that as you know, a reference. We see some that comes during chemotherapy, and I think it's extremely useful and beneficial, even though there are a lot of challenges, because people experience side effects of chemotherapy completely different, to a different intensity, especially the fatigue. It's a big one, especially if they have to go to a place to exercise, or they can do it alone. Also, the neuropathy is something that it's very distressful for patient in terms of exercises, even walking sometimes. So my advice is always to start on the first dose of chemo, even before, if possible, even though it's a moment that a lot is going on. So starting exercise is not easy. I can see that. Actually, also when I stayed in the Netherlands, my old thesis was about a trial whether it's better to start during chemotherapy or after. That was the old thesis project, and evidence shows that, of course, it's better to start when you are on chemotherapy, especially because you're not gaining much on, let's say, functional and performance and cardiocirculatory perspective, because the chemotherapy is such a huge destroying treatment to some extent. But we saw in this project especially that if you start, for example, the VO2 max, which is the capacity that your body has to use oxygen, and of your muscle to use oxygen, you can really prevent a huge decline if you start during chemotherapy. To the extent of we saw that during chemotherapy, like patients were losing around, the patient that they were exercising were losing about 5% of this VO2 max, which that is a very important parameter for your health. And instead, the people that waited all the chemotherapy and started after, they were losing like 20, 30%. That is something that you see over like aging in 10, 15 years. And this was happening just over a course of 3 months. So, and also I want to say something else about exercising during chemotherapy. Really, there are no days, absolutely, which you are not able to do anything. Many patients tell me that. And in those days, even a slight amount, like 10 minutes walk, climbing 10 floors of stairs, what you can do, it's already enough. And then try to do your best in the days that are next to the next dose, because usually it follows, a graph. So like when you do the dose, you have like the first 3 or 4 days that you have like the most intensity. And then, of course, depending on the scheme, you should really maximize your effect of the exercise when you're feeling a bit better. Like in those days, exercise should be a priority to my extent.
Mm-hmm. We have here someone asking about massage. Can you read the comments also, or do you like me to let you know?
I can read it. Yeah. I
Okay.
can read it.
Yeah,
So
experience for oncology patients is still considered a taboo topic.
hmm, at least in Italy, it is. Uh, as for the other, it's growing. People are less skeptical about it because there is the misconception that you're gonna spread the cells through the body with the massage, and it's still a taboo also here. But it's growing, especially the gentle technique of massage, and they are like we have a massage in our center, and patients really like it, especially because it's something. I don't know if it's really something that works on the muscles and on like the decontracturing some muscles, but it's really helpful, I think, for the patient, for like the idea of taking care for himself or herself, and really, how to say, have a moment for themselves in which they can relax. This also impacts them, I think, in a positive way. But especially on this specific technique that she was mentioning, Agnieszka, I am not experiencing that, so I cannot give any advice.
Of course. Now, what are the benefits many people don't realize? Apart from, the muscle gain and, even, what are the biggest benefits of starting physical exercise, pre or even during treatment?
Yeah. As I was saying before, there is I mean, we all know that chemotherapy is a treatment that kills the fast-growing cells, and this includes our blood and the platelets. So I think that exercise has been shown, even though there is still a moderate evidence in the bigger like research scheme, that it's helpful to improve or decrease the loss of them during exercise, during chemo, sorry, of course, with the due safety consideration. For example, avoid public and crowded places if you have a low white blood cell count, if you are suffering from anemia and low red blood cells, you shouldn't exercise really hard because the red blood cells carry oxygen, which is what the muscle use. But I think that exercise can be helpful in that extent, in the cardiorespiratory fitness that we were saying, because there are some specific drugs like epirubicin and doxorubicin that are actually they damage the heart directly. So even starting very low on cardio, doing some cardio during treatment is helpful to prevent a big loss of cardiac function. Muscle strength, it goes for the same muscle mass and muscle strength. People during chemotherapy also exhibit a kind of change in body composition, even though this is a bit more pronounced in hormonal therapy, especially in breast cancer. But also, like clinically wise, absolutely, these two main components of the muscle and the heart that are like the key components of exercise in general, starting during chemotherapy, they can be prevent. And sometimes we also focus, for example, if you talk about radiotherapy and exercising during radiotherapy, we always advise and give some gentle exercises to breast cancer patients to maintain shoulder function and shoulder mobility, depending on where they got the radiation. Of course, the radiation goes like really deep, but there is a whole like body of tissues there, the fascia, the muscles, and that gets a bit tightened up in during radiation, and in that case, mobility exercise very gentle and listening to your body, I think they can be helpful in preventing this usual tightness of tissues that will come anyway because radiation therapy is also a powerful treatment. But I think that if patients do it during, they can preserve more shoulder mobility after, and then they can do more after.
Yes, very true. What about, but I mean, apart from all of the physical part, I mean, there's also the mind, correct? And I mean, I believe that physical activity also helps
Absolutely.
tremendously once. And what are your experiences in terms of that?
During chemotherapy, yeah, this is a huge part. I was focusing on the physical, but they go hand in hand. So absolutely, like even the fact that you're doing something that you're able, what a patient told me once and is been like repeating is that is the feeling of control. Because when you're exercising, you feel in control of what you're doing. Like you do the repetition, the movement, you go to your own intensity, you feel you're able to do something. And during chemotherapy, and actually the whole cancer experience and the disease, is something that goes out of control. Like you're just receiving a passive treatment, you don't know what's going on in your body, if it's growing, if it's working. So this is also a point that many patients says that, of course, compatible with the level of fatigue and tiredness that this is something happening. And also, like as I was saying before, this group exercise effect, and especially we are in a gym that is solely, they can relate, they can get suggestions maybe on what to eat, or they can talk about completely something else, which is something that have been, I've heard from them that they just want to go in a place where they can not think about it, do something else, not being in the stress of taking medication, feeling side effects. But of course, also during chemotherapy, the adherence to exercise is quite low. To an ideal program, the adherence, I think, if I remember well, is around 50 to 60% to the planned session. And that is completely normal and understandable. And still, it's something. Even this 50%, it's really something, and it's really beneficial for the mind. And actually, it will help you to do more exercise after you have finished.
Yes. Now, two more questions. I'm sure you believe, and you are already working. I mean, that every oncology hospital should have these multidisciplinary group, including physical therapy, of course, correct, and physical exercise, of course. And I mean, what can we as a society do for such to start happening more? And then the other thing too is that, I mean, as you know, there are many professionals as yourself who are not, you know, oncology experience, they don't have the experience in oncology. So how do you go about working, for example, a person, let's say that they live somewhere where there is not someone as yourself trained for oncology. What is the best situation also for them to be able to still exercise, but working with a professional that, well, unfortunately might not know everything as you yourself know. So is it better for them not to do it at all or still do it with another professional?
That's
What are your thoughts?
an interesting question. It's a very interesting question, this last one. I will start from there. And mm, like, I've got a lot to say. There are a lot of patients that maybe they have been following from a personal trainer before, or they go to the gym, then they start the oncological treatment, and they go to them and say, "Hey, I'm doing this and it. What's going on? What can I do?" And there are at least from my experience, two possible ways. One is that the fitness professional, the healthcare professional, the physiotherapist will say, we do everything as before, and is risky because there are structural and motivational changes. This has to be taken into account. The other circumstance is that the healthcare professional or health professional, they don't know much about cancer. It's such a stigma still to talk about it that they're really like, no, I'm not doing anything. Go talk to your oncologist. I don't know what to do. And I think that there should be an in-between approach. Well, of course, as a systematic change, more health, fitness and health professionals should know more about, especially the treatments. I think this is key because with the little non-profit association, we did some workshop on exercise and like focus on breast cancer, which muscle to train, which muscle to more like relax and stuff like that. And I think that the key for a fitness professional, even though they don't have a certification, they don't have the time to do it, even though I mean it's really needed or preferred, I'm not saying. But I think like what was the key for me is to really know really well the type of treatment, the mastectomy, the lumpectomy, the axillary dissection, which muscles are going to be in balance, which not. The difference, if you want to work like, let's say, clinically, I'm talking about the clinical part right now. This is really important. How does chemotherapy work? How does hormonal treatment work? What side effect you're gonna get? You know you're gonna get bone loss in this patient. You know it's gonna happen. So even though like you have to include in your exercise program to your patient, your client, a part that is like related to their treatment. And this I did it like studying really well the treatment and how they affect the body. And I think that also what worked for me in Italy is as an exercise professional after this, let's say, specialization in the treatment of oncology, go talk with the oncologist, the cancer center, you might find somebody that is interesting. Might not be hard, no, might not be easy, might not be the first one, might not be the second, but since it's a growing body, since it's something that it's kind of general knowledge that exercise is beneficial, uh, you will find somebody that will give you some credibility, especially if you really go out there and you are perceived as somebody that knows what he's saying and that they can operate in safety and effectiveness. Because I understood that the doctors, oncologists are really concerned about safety, that they're not doing something that they might hurt them. This is, for example, I had a patient once that contacted me after treatment and she was a marathon athlete and she was doing the same training as before the chemotherapy, during the chemotherapy. And you cannot expect your body to react the same. And if you do that, you're going to harm yourself.
Mm-hmm.
So
Yes.
this is something. And also another point is to go talk with the local patient association. They usually are somebody that are there for the patient. It's usually no profit, so it's more, open, let's say, and for the people. And at least that's what worked for me. Like 3 or 4 patient association said, okay, let's start this online exercise program, live exercise program, even consultation. Sometimes it's not the best, but it's something.
Of course, of course. Now, all
Yeah.
of that, I mean, everything you're saying does make sense. And I mean, hopefully, we are slowly going more into the path of a more of a holistic, integrative team of professionals, which is what we really hope so to achieve sooner or later. I mean, have there ever been situations where any oncology patient that you had some resistance, let's say, in starting a plan of exercise, because whether it is because of what they heard of, or they were scared that they wouldn't be able to follow through with a plan. I mean, I'm sure they are, it's not, some will right away adhere to the plan, others are, it's a bit tougher. So you have to adjust at all times, correct?
Absolutely. Yeah, yeah. Especially during treatment, this is something that you see a lot of times. Especially on if you want to do like 3 day per week program, or some live training while they are on chemotherapy, or if they are even at the end of it, but they still have all the cumulative effects of that. It is not easy, and like what I do focus on is in explaining them the importance of it as a general concept, and then based on their situation, I'm really careful that they understand that, and that thought and concept is in their mind, and maybe with time it will grow, they will feel better because like naturally the chemotherapy effect decreases, so they can start after some time after chemotherapy, or during chemotherapy. Some people are just devastated, so they really cannot think about doing that, and that is fine. I mean, you cannot just like telling them to do as much as they can, even some walking. It doesn't always have to be exercise with bands and weight and mobility. For some people, this is enough to walk and to do some walk during chemotherapy, and it actually helps. It actually helps only with the walking. If you can do more, it's better, but you find some resistance, and that's why also the group setting can help. Live and in group can help make you really have to try to make it fun. As for most of us that are not exercising for either like performance, or because we are paid athletes, you have to find the right motivation for that, which sometimes can even be, and I've been told that, aesthetic. I've seen patients that come to me and ask me, I'm coming to exercise because I want to have better arms, less, more tonic arms, glutes as well, legs. And if it's a motivation for them to exercise, why not? I mean, because the benefits then are transferable. Like, it's not that you are just focusing on one thing, because exercise it's a very good thing, because the benefit translates into many aspects of your health. So there are these little techniques to try to overcome the resistance, but if it's really hard to do it, they will start when they can. The importance is that they understand that it's essential for their health, both mental, physical, and clinical.
Yes. Now, now we've been talking mostly about treatment during, pre and during, and there is also a lot of research that shows that even after is just as important, if not even perhaps more important, because there are less chances of having the cancer coming back, correct?
Yeah, exactly. And actually, this new trial, the challenge trial performed by Kerry Cornelia, University of British Columbia, and many more centers, I've been shocked because there was this old school oncologist, let's say, that came to me saying, "Hey, did you see this trial?" Because they did like a really good job in it's a randomized control trial with almost 100,000 patients followed over the course of 9 years. This was a type of evidence that was needed, that was lacking, having such a structured research with such good effects. And this is something that the oncologists need as a forma mentis to prescribe exercise. Uh, and yeah, if you're not doing that for the aesthetic, for the quality of life, do it for that. And many patients do it actually for that. They tell me that they come because of the fear of recurrence, the fear of having a second cancer unrelated to the first. And this is also, it's good that such evidence is circulating because it gets in the mind of both the doctors, the oncologists, and the patients. And also after what is being told is that, especially in breast cancer, but prostate cancer as well, and all the other, the side effects doesn't stop because you have such a long time to take this, or especially the hormonal treatments. They and the effects are there, are permanent. You can adjust to them, but physical activity and exercise is one of the most powerful non-pharmacological things that you can do to really, especially this joint pain. A lot of women come to me and say, when I wake up in the morning, I barely can move my joints. I feel like a 80-year-old person in the body of a 50. This is something that exercise can help in. It cannot completely take it out because it's biological, especially with the aromatase inhibitors. But it's one of the best solution. But it's a bit tricky because you have the feeling that you are doing something, and like usually with rehabilitation in general, you do something, you go back to your like con first condition, so like that you don't have pain, for example, in the joints, in the rehabilitation setting. But in that case, it's different. You have to live with it. And there are days that it goes up, days that it goes down. But with exercise, let's say it's a bit like that. You know, it won't stop, but you can decrease it. As well as for all the other complementary treatments, body mind technique, massage, acupuncture, nutrition. So after treatment, it's also extremely important to keep on doing that.
Great. I mean, I don't know if anyone else has any other questions, or would you like to talk about anything that we might not have talked about? You tell me. But I mean, it's very important to really talk about how exercise I mean, should really accompany the patient from day one, really.
Sì, no, absolutely. And well, I would like to say one thing that is really something that I care about, and there is also a growing body of evidence there, and that is exercise with bone metastasis. That is
Yes.
a field that it's tricky, it's difficult. If we were talking about all the barriers for exercise in cancer patients in general of before, imagine with bone metastasis. It's 10 times. They are skeptical, they shouldn't move. And of course, there are some situations, but like thankfully, the growing body of research is showing that uh, you can exercise. You have to be careful on what to do and what not to do, depending on where the lesion is, the kind of the lesion, if it's lytic or um, addensante, like aggregating, how extended it is, how is your whole body structure covering for that weak bone, because that is also something. I've seen patients that they come and they are kind of fit, they do their job, they live, and then the orthopedic says you cannot do anything, wear the thing, the stabilizer for your spine, for example. And they said, but I've done everything so far. Why I have to do it? And there is still a lot of skeptical thoughts on that field, but also like thankfully for also there is the Bone Metastatic Exercise Hub, which is an initiative from the British Columbia University that has translated a whole body of evidence and patient hands-out and brochure that says that for you to exercise is safe, go contact a person that is experienced for that. Of course, you gotta start slow. You cannot do everything maybe that you were doing before. If you were doing, I don't know, burpees or anything that might be dangerous, but you can still do something. That is something that I hope with the growing body of evidence, uh, exercise can be available and prescribed also to those type of patients, which because for them it's really important to maintain their functionality, quality of life, because if you don't move and you are already in a metastatic stage, your functionality, your quality of life, your social connection will decrease over time. And like maintaining that autonomy in your life.
Okay, well, I see that we covered quite a bit of information here, and it was really interesting. And thank you so much for your time. Hopefully, we'll have other opportunities in the future to talk to you. I believe it was really insightful, lots of great information, and let's hope also that more and more research comes out showing that physical activity is indeed very important, and that we can keep on working together for more patients and also more oncology doctors to understand and prescribe physical activity. Thank you so much for your time. Really appreciate it. And
Thank you
until next
very much,
time.
Sophia, and thank you for inviting and can't wait to be here again.
Perfect. Thank you. Have a
Thank
great day. Thank
thank
you
you.
all who assisted, and we'll be able to assist later on. Thank you.
Bye bye. Ciao.
Bye.